The organizers of CONy this year, they responded to a request to involve ethics in some of the debates. And so I and my colleague, Dr. Jaretsky, were able to address that. They assigned me the yes position to the question, is it ethical to provoke psychogenic non-epileptic seizures for purposes of diagnosis? And really what I had come to learn working with the International League Against Epilepsy task force, we surveyed seizure monitoring units around the country, around the world, and found that of 94 countries and 411 clinical practices with over 400 respondents, that 72% of monitoring units are actually using suggestive seizure manipulation methods. What we found was that of those, most had favorable opinions regarding the utility of suggestive seizure manipulation. And they either agreed or strongly agreed that it is useful in the diagnosis of psychogenic non-epileptic seizures. About over 70% noted that it allows clear diagnosis in more patients with psychogenic non-epileptic seizures than not using it. They believe that it permits quicker diagnosis in more patients. Many times people might be in for longer periods, and there may be that no seizure is produced during the monitoring. So that comes out as really not helpful because there wasn't a diagnosis made. And then also many thought that it allowed for shorter hospitalization for video EEG.